Thank you. And thank you, Commissioner. It's been a pleasure working with you over the last year. Let me help out my colleague here, because I was going to ask about the Ombuds program as well. Have you considered a travel allowance for the volunteers? Because certainly in our part of the state, they have to go long distances often.
Yeah, many of them have that have an allowance built in, so that type of thing should not be on the backs of the volunteer. What I like about the stipend idea is it's a low budget, high yield impact. It recognizes the value that these folks bring to the table every single day. It's something that's pretty complicated and not always positive if you're seeing, things that you don't want to be seeing in some of these facilities. And, I think that on the receiving side from the volunteer, in addition to all the other recognition things that the program does and the support that we try to provide in various other areas really is monumental in terms of them feeling valued for the time commitment that they put into this. So we're certainly not adverse to any of those types of incentives that are going to help not only, again, recruit people, but make sure once they're in and feel that it's a volunteer experience that's important to them, that we hang on to them.
Okay, great. So let me go back to these issues about keeping people in their homes and out of nursing homes. And the first question is, in the MRT process, do you anticipate having a voice in what gets decided? And do you think that community-based programs that serve the elderly will have any kind of input into that process?
I do think we will be and always are and will be interacting with our health department colleagues. And I think that Dr. Zucker and Donna Frescatore mentioned that yesterday. I think because the way that we kind of view our role in concert with the health department is that we do have a continuum of care. We're the front end of that. We are pre-Medicaid. We're trying to keep people out of the emergency room. You need a strong community-based network to be discharged safely back to the community. So there's always going to be a positive interaction between those two things. I don't think it should be lost on any of us that investment we got last year came from the health department's budget, because they recognized that we are able to target certain individuals that eventually could wind their way into the Medicaid program, that we can do it for very, very low cost. Hence what the investment is. So I feel confident moving forward that some of the things that our network may be able to offer will be part of that conversation.
Thank you. So that $15 million investment last year was predicated on a savings of about $34 million from Medicaid in keeping people out of nursing homes. Have you run the numbers? Are you seeing that kind of savings? Is it too early to tell?
Well, I think, what we did do is we were able to tag future Medicaid savings, because if you're receiving services in our network, you are not receiving services somewhere else. So, we began the process with some assumptions based on some feedback from the area agencies that reported what happens to people if they're awaiting services and not getting them. I think what we have a little bit more definitively at this point, I think our reporting requirement that we had agreed to in the budget last year is September, so I'll know a lot more by then. But I can tell you this. I asked 10 of the counties fairly recently to go through some of their client data of folks who were awaiting services when they reported it back in the 17-18 cycle, which predicated the $15 million, to the time that we were able to release the money based on the enacted budget. What happened to those folks? And so they went through 2,200 individual case files, which is a monumental labor-intensive process, and I appreciated that they did that. And I think Assemblyman Bronson hit it on the nose. Those numbers are similar to what we found. 10% went directly from awaiting services into a nursing home. So that would have had a cost, because, again, the clients that we're serving are traditionally 83-year-old females who live alone, are low income, have 4 or more chronic conditions, and have 3 needs in, their functional needs in a variety of different areas. So they're pretty much at risk. So again, I think that the investment speaks for itself.
Thank you. So, like Assemblyman Bronson, it makes me wonder, why do we don't just multiply it by the investment by 10 and reap, that much more in terms of the savings. So I'm interested in a few things where I feel like we're kind of nickel and diming our home care system. There's not a COLA in there again. We're deferring the cost of living adjustment yet again, which makes it harder to find people to do the work of home care. I didn't see if there was an increase in funding for NORCs, but that's a way that we support, a pretty low-cost way of supporting seniors in their homes. The Affordable Senior Housing Service Coordinators what I'm told is they save about $4,000 per person per hospitalization, helping them, coordinate everything more easily. The Senior Companion Program that we have out in Onondaga County, where seniors are going and just visiting with isolated seniors, and it's great for both the volunteers and the people who are receiving those services. Data systems for senior centers to connect with hospitals for discharge planning, so people aren't missing meals, if home-delivered meals or that kind of thing. So tell me about all of these areas. Is there room for further investment in these in order to save a lot of money on the Medicaid side of things?
Yeah, and I think you mentioned a lot of very important programs that are a part of a much bigger coordinated system. And that's why, again, when we're going through the private pay protocols, and what we want to do is try to get people to the front door of the Office for Aging, because they're not looking at one particular program. They're looking holistically, using a person-centered approach at the individual, and what do they need, what are their strengths, what other things can we leverage. So, I think that those things are very, very important. It's very difficult at times to get people to accept services, but that's the culture that we live in, and our job is to make sure that we're out there in the communities, letting people know that there are a variety of things they may be eligible for that they're not receiving, that we can help them with. I think what's the most promising thing, and now being in this network for 27 years, what's happened over the last couple of years, at least where aging is concerned, to me is very exciting. The focus on value-based payments, the shared savings with Medicare allowing services to be paid for that address the social determinants of health. All of those things that we do very well in our network. And so we've had some very, very productive conversations lately with Emblem, with Excelis, with the Albany PPS, with the Adirondack Health Institute, that are looking for ways not to recreate the wheel. And that's where we fit in. We've got a network that's been around for 50 years that has, again, 59 offices for the aging, 1,200 community-based contractors that provide a variety of services that you just talked about, as well as, 800 congregate sites, 2,400 home-delivered meal routes. There's a lot that we can be doing and looking to diversify our funding, whether it be through private pay, Medicare contracts, others, to significantly expand service to do exactly the kinds of things that you and Assemblyman Bronson had mentioned.
Thank you. And then the last thing is to talk about what's my top priority legislatively, and I believe Assemblyman Bronson's as well, which is the Family Caregiver Tax Credit, which is partly just a recognition of all the work that families do, but it's also intended to make it easier for more families to do that kind of care and plug the gap in terms of the lack of the home health care workforce, and also to help people stay in their homes so they're not going into nursing homes. So if that didn't make it into the budget, is that something that you're willing to advocate for? We feel that that's very important. AARP does. It's potentially a really valuable thing in terms of return on investment, I believe.
Yeah, and there's been a lot of conversations about the tax credit, so I'm sure, again, as we move forward, that it's not going to be the last time it comes up. I can tell you one of the things I'm proudest about of the state is the caregiver investments that not have only been made in our agency, but also in the health department. I think one of the most exciting things that we're working on currently that I just quickly share with you is I think we get a lot bigger bang for the buck when we can show what the impact of caregiving is to the economic bottom line. So we are working now with AARP National, AARP New York State, Emblem, New York State Health Department, and Excelis to do a really comprehensive study impact of caregiving on state employees, county employees, and then maybe the 20 biggest businesses in New York State. We have the ability through some health insurers, Emblem, Excelis, to look at claims data. What's the impact on healthcare spending of caregivers? What does it cost businesses in terms of turnover? Lost productivity. We know the wage reductions for women, which is a huge problem. So I think that, collectively, the impetus behind getting data like that is really going to be an eye-opener, not only for at the state level and the county level, but also through private businesses, where then we can be working together to provide strategies that not only help identify who caregivers are, because that's the #1 problem, but also connect them to the myriad of services that we have in New York State. We have over 76,000 respite and caregiver programs at the community level that people, use but may not know about, because a lot of this is crisis-driven, as you know.
Right, great, thank you. Is there a date for when that report will be
Well,
done?
it's going to be this year. I mean,
Great.
we are moving quickly, and there's a lot of excitement. It's going to be not only a great assist to New York State, but it will become a national model to really, hone in on this at the state level everywhere,
Terrific.
because
Thank
it
you.
matters, as you know.